Well, welcome to our 14th webinar from the School Health Research Network. It's the last one of the academic year, and we're going to be learning about some more network research to help with your school health and wellbeing. So we're very they can't hear me apparently. Gillian's just told me.
I can hear you.
Oh, right.
Fine.
Okay. Oh, well, I'll keep going in the hope that that was just a problem in one person's computer. It is with great pleasure that I welcome an old timer to the webinar scene. Graham is going to talk to you today about vaping and cigarette smoking. But just before he does, you'll notice that there's a band on the left-hand side, and if you've got any questions or anything you want to raise, then you can just type in there. So I will just tell you, just go straight with, there we are. So we're there at the webinar, and I'll hand over to, now we've got, there we are.
Okay. So I'm Graham Moore. I'm Deputy Director of the CIPHER and Deputy of the School Health Research Network. I'm going to be talking about some research me and the team here have been doing around trends in tobacco and e-cigarette use over the last 20 years or so, using SHRN data as well as data from the Health Behaviour in School Age Children Survey and other data sets from England and Scotland as well. So just to mention, these findings are currently under embargo because a press release has just been sent out and the paper will be published on Tuesday. So nothing to be tweeted or broadcast until Tuesday, if possible. So we'll be talking through some kind of key changes in young people's use of tobacco over the course of the last 20 years or so. Then, after talking about trends for tobacco, we'll talk about the emergence of e-cigarettes and data on how young people have been using e-cigarettes over the last few years. And then kind of tying those two things together, I'll be talking about kind of arguments about whether e-cigarettes renormalise smoking and some of the work we've done to kind of test that idea. So, why is smoking important? This is a slide that was provided by my colleague Linda Bold, and it's WHO figures which suggest that in the 20th century, smoking was actually responsible for more deaths than all of the wars in the 20th century put together. One person dies every 6 seconds from tobacco use. So these are figures from a few years ago, so I hope that's slightly less now, but smoking rates have only fallen very slightly over the last few years in adults. So in terms of why preventing uptake of smoking in youth really matters, most smokers start smoking as teenagers, and then smoking is incredibly hard to give up. It's incredibly addictive. It's hard to give up later in life. So very often, having taken up smoking as a 13-year-old, 14-year-old, which are kind of for years, those have been the kind of typical ages of first smoking, that just continues into adult life. And actually, there are lots of kind of estimates around the percentage of kind of people who actually die as a consequence of smoking. And it's kind of the only consumer product which, if kind of taken as directed by the manufacturers, kills 50% of its users. So over the last kind of 20 years or so, public health actions included a lot of investments in learning what works in supporting smokers to quit. So people who've developed and established a smoking habit, how do we kind of transition them out of that? But also kind of working with schools and policy to kind of prevent young people from taking up smoking in the first place. And this has been kind of an area where there has been a huge amount of public health success. Going back to 1998, when I was actually just leaving school myself at that point. These are figures for 13 to 15-year-olds in Wales. Going back to 1998, most young people by their mid-teens would at least have tried a cigarette. So just experimenting with tobacco was just a normal part of what young people did. That's changed quite dramatically. You see this kind of gradual sort of linear decline over the course of the last, that 17-year period we're looking at here, whereby by 2015, less than 20% of young people in that age range have ever tried tobacco cigarettes. It's just not a normal part of being a teenager anymore, the same way as it used to be 20 years ago. So those were figures for experimentation, ever using tobacco cigarettes. These are figures similarly for kind of regular smoking, so smoking at least one tobacco cigarette a week. And again, those figures have fallen from just below 20% down to around about 5%, so roughly fallen by a third to about a quarter. To about a third or a quarter of what they were almost 20 years ago. So, I mean, just to recap, I mean, experimentation, trying a cigarette was just something that most teenagers used to do. Taking that risk, experimenting was just a normal part of being a teenager. Most young people would leave school having tried a cigarette at least. I remember when I left school around that time, it was quite unusual to meet someone who'd never tried a cigarette. At that time, it felt quite strange when people said that they'd never touched a cigarette. But over the course of the last 20 years, ever use amongst teenagers has fallen really rapidly, and now the vast majority of young people haven't ever tried a cigarette. So that's a real kind of public health success. And regular use has also fallen very rapidly, although there's some kind of suggestion, going back to that previous slide, that decline is starting to kind of level out a little bit. So what's changed in this time? There's been lots of public health action at kind of multiple levels, including policy and legislation and action within kind of schools and communities. So things like bans on tobacco marketing, increases in minimum purchase age to 18. That's been reinforced through kind of Challenge 25 campaigns, where retailers are encouraged to ask people about their age if they look like they might be younger than 25. So that young people can't just send their older-looking friend to buy their cigarettes for them. We've had the ban on smoking in workplaces in 2007. Bans on smoking in cars carrying children followed in 2014. We've seen a range of kind of effective school-based programs, so kind of Assist and a kind of model that's been rolled out under the name Just Be, which is a similar program in Wales. And kind of strict kind of anti-smoking policies within schools have kind of had quite an impact on young people's perceptions of smoking, just as a normative behaviour, as something that's just acceptable and normal to do. And we are seeing kind of increasingly kind of layering of progressive legislation on top of legislation. With the Public Health Act last year, schools will shortly become completely smoke-free places by law. Most schools ban smoking voluntarily or anyway, but by law, school grounds will become completely smoke-free shortly. So just to kind of illustrate on this point, actually, one of the kind of key successes here has been denormalizing smoking, turning smoking into something that's just not a normal, acceptable thing for young people to do. And these are figures from Scotland and England, because there are no equivalent data for these outcomes in Wales, but in those countries we've seen very similar trends for smoking, so I think this is a fairly transferable finding. But going back to 2001, about 70% of 13 to 15-year-olds said it was okay for someone their age to try a cigarette to see what it's like. Actually, that's fallen all the way down to around about 25% now. So, I mean, this is a big population health success with some kind of qualification. Declines in smoking have generally been greatest in more affluent communities, so smoking still continues to play a huge role in the gap in life expectancy between rich and poor. So I've heard estimates that actually if we were to eliminate tobacco altogether, the gap in life expectancy between rich and poor would be roughly half. I've not been able to kind of trace the sources of those figures, but those are common figures you hear kind of banded around in that area. And there are also kind of huge associations between smoking and kind of mental health problems, which is a kind of key priority area at the moment. But just moving on to, I mean, as smoking has declined, today's kind of generation and young people have kind of grown up in an environment where smoking is becoming more and more denormalized. E-cigarettes have kind of emerged during that time. So they were first invented in China in 2003, and they began to gradually enter UK markets from around about 2010. And they've become kind of increasingly sort of diversified products in terms of kind of what they look like, how they work. The very early generation e-cigarettes looked very much like cigarettes with a glowing tip, but they've started to look less and less like cigarettes as they've developed. And these are figures for kind of use of e-cigarettes amongst adult smokers and recent ex-smokers. You can see that entry to the market from around early 2011 and a rapid growth followed by a kind of leveling off from around 2013. So since about 2013, use amongst adults has stayed roughly stable. But what we have seen over that time, since 2014, is a movement away from dual use, so away from kind of most vapers also being smokers, towards a position where actually most vapers are ex-smokers, so have given up smoking. So e-cigarettes have kind of increasingly kind of played a role in helping people to stop smoking. But they have been quite a sort of polarizing public health issue, in that although there is that growing evidence of significant impacts on cessation for adults, and it's true that we don't know for certain exactly how harmful e-cigarettes are, but I think it's extremely unlikely that we'll ever be in a position where we find that they're as harmful as tobacco. So the things in tobacco that are extremely damaging are the things beside nicotine. Nicotine in itself has kind of few kind of harmful effects for adults. It's all the chemicals that go into cigarettes alongside that to deliver the nicotine to the brain as quickly as possible that have the really adverse consequences. But increasingly over the last few years, we have seen evidence of kind of non-smokers, including young people, kind of experimenting with e-cigarettes, although regular use does remain quite rare. And there have been kind of arguments for increasing regulation around e-cigarettes, which are driven by arguments, sort of fears that e-cigarettes might renormalize smoking. So all that work we've talked about in making smoking something that's not seen as normal by young people might kind of start to be reversed. And there are kind of counter arguments to that as well, people arguing that actually when you see someone using an e-cigarette, that's a social display of an alternative to smoking. It's a social display perhaps that someone is trying to not smoke in front of other people, or they're trying to give up smoking. So actually, does that contribute to further denormalizing smoking? But this has kind of evidence is kind of rapidly accumulating in this area. But I think up to this point, policymakers have been operating in a bit of an evidence vacuum, and it's been a challenge to think like how we regulate e-cigarettes enough that they don't get used by non-smokers, while kind of avoiding regulating them so much that smokers are put off switching and continue to smoke. So these are figures for e-cigarette use amongst young people in 2016. And the figures on the left are kind of the overall prevalence rates. And these vary quite a bit because the populations, the age ranges of the surveys are quite different. So that's key, you can see on the right. But the figures with the arrow pointing down towards them, that's kind of regular use of e-cigarettes amongst kind of never smokers. We can see that actually that still remains extremely low. So this idea that kind of e-cigarettes are sort of creating a new generation of young people kind of addicted to nicotine is probably that's not really something that we've started to see as of yet. It's something we need to keep a close eye on, but it's not really something we've started to see yet. But I'll just talk now about kind of some of the work we've done to kind of test this kind of concern that e-cigarettes might be starting to kind of make smoking look normal to young people again. And this is work we've done combining data sets from England, Wales and Scotland. And we've looked at trends up to around 2010 and then from 2011 onwards, after e-cigarettes began to emerge, in kind of ever smoking, in weekly smoking, and also perceptions of whether smoking is okay. And then also to kind of locate that within kind of broader trends in relation to young people's substance use more generally, we've looked at trends for kind of cannabis use and alcohol use as well. So this is something that we kind of call an interrupted time series design, where essentially what we're doing is kind of looking at whether there's a change in the trend after a particular point in time. So if there's no kind of impact of e-cigarettes on smoking, we'd expect this green line, as it was kind of falling prior to their entry to the market, to kind of just continue as it was. If e-cigarettes are beginning to renormalize smoking and smoking rates are starting to kind of show some sign of picking up again, we might see something that's a little bit more like the red line, so a disruption to the kind of rate of decline in smoking. So in terms of some of the kind of key results from our analysis, these are some of the figures for ever smoking. So whether young people have kind of ever tried a cigarette. So you can see there's quite a rapid decline from 1998 all the way through to 2010, and that's the red line kind of represents the point in time roughly where e-cigarettes began to kind of gain some kind of penetration within UK markets. And you can see for ever smoking, which is kind of a key marker of sort of normalization, it's okay to just kind of experiment with something. It's something that's kind of seems desirable to kind of try. You can see that ever smoking hasn't really been disrupted. That trend has continued to decline at pretty much exactly the same rates as it had up to 2010. We did see in our analysis that for weekly smoking, which we kind of started to see a little sign of when we put the slide up earlier around regular smoking rates in Wales. Over the last few years, the decline that we've been seeing over the last 20 years in regular smoking rates, so the percentage of young people who are weekly smokers, that has started to bottom out a little bit. Whether that's a consequence of e-cigarettes or whether that's simply that it's got to a point where actually it's just not likely to go much further is kind of challenging to completely unpick. But when we look at kind of subgroup effects, we see that this kind of trend is driven by kind of groups for whom the decline in smoking was really rapid up to 2010, to the point that it simply couldn't have continued without kind of reaching zero. And this is these figures represent responses to items on whether it's okay to try smoking. So again, we see quite a steady decline from 1998 through to 2010. What we see here is actually particularly interesting, because rather than smoking becoming more normal again, we see kind of an acceleration in the rate of decline for the percentage of young people thinking that smoking is okay. So kind of the opposite of what we'd expect to see if e-cigarettes were leading young people to see smoking as normal again. And actually some of the kind of qualitative interviews we've done with young people kind of suggest that actually a lot of young people are kind of saying that actually smoking is even less acceptable now because there is an alternative available. So intuitively, I think there are a lot of concerns that e-cigarettes might make young people think smoking is normal again, but I think young people are often seeing e-cigarettes as a very different thing to tobacco, and a lot of our kind of conversations with young people and some of the primary school work I'm doing at the moment about how they perceive e-cigarettes, they actually quite actively kind of reject that term e-cigarette. They reject that label which ties them together as being something similar to cigarettes, and prefer kind of terms like vapes, which don't have that association with smoking, which still continues to be generally quite frowned upon, quite stigmatized.
Really interesting.
I mentioned that a couple of the other things we looked at in these analyses were cannabis use and alcohol use, and there's no real reason to kind of believe that the growth of e-cigarette use would have had an impact on either of those things. So the reason we kind of modelled this was to see whether, if there was kind of a clear evidence of a disruption in the trends for smoking, was that kind of specific to smoking, or was it something that was happening across kind of other substance uses as well? So did this sort of shift represent kind of broader sort of changes in substance use trajectories for young people? And we can actually see that for cannabis, the disruption to trend is kind of even greater. Cannabis use continued to grow a little bit beyond the point at which smoking started to fall, and then declined quite rapidly from around about 2000, 2001. But that is starting to kind of level off now. I think some of the even more recent data from England is suggesting that cannabis use is actually starting to kind of rise ever so slightly again. Whether that's again sort of tied to ideas of normalization. We've had lots of kind of international debates about kind of the regulation of cannabis, lots of kind of Western countries starting to legalize cannabis and kind of communicating sort of messages that actually maybe cannabis isn't as bad as we've been saying all along. So I think there's lots of kind of confusion around sort of normative messages for cannabis at the moment. And these are trends for alcohol, and again, there's a larger sort of disruption in the trend prior to 2010 for alcohol than there had been for smoking. So again, this isn't something we'd expect to be sort of driven by e-cigarettes, but we can see that there is kind of across a range of substances this kind of bottoming out of the kind of decline that we've been seeing over the last few years. So just to kind of summarize some of that, I mean, there's no real kind of evidence from the work we've been doing that the kind of growing prevalence of e-cigarette use has kind of led to increased experimentation with smoking amongst young people. And actually what we've seen is young people's perceptions against smoking as a normal kind of acceptable behaviour. They've actually continued to harden, and at a faster rate rather than sort of softening. So, and although that the decline in weekly smoking rates is starting to slow down, that kind of seems to reflect a kind of floor effect. So an effect that amongst some subgroups where there simply isn't room for it to fall anymore. And it's also of smaller kind of magnitude than some of the changes we've seen for other substances. So we are kind of in a period at the moment, I think, where the kind of the kind of declines in risk behaviour more broadly that we've been seeing for the last 20 years or so are kind of starting to bottom out a little bit. I mean, I think we always have to be kind of cautious when I'm not kind of saying at all that there is no risk posed by e-cigarettes at all. This was up to 2015. The products can continue to evolve. I think over the last couple of years, we have seen quite kind of rapid growth in e-cigarette use in the United States in particular. And we'll be, our kind of national Shern report will be presenting figures from Wales from late 2017 very soon. But I mean, those don't seem to show the kind of acceleration in use that's been observed in the United States. I think potentially part of the reason for that is that actually there have been kind of regulations introduced here which have prevented entry to the market of some of the products that have proved particularly popular amongst young people in the US. But that's something that we need to kind of keep a close eye on as the devices continue to evolve. Do they gain traction within the youth market? At the moment, there are kind of a range of kind of regulations for e-cigarettes that have been introduced over the last few years. I think really e-cigarettes emerged onto the market more rapidly than anyone was really ready for. So there wasn't. It kind of seems strange now to look back and think that up to 2015 there were no age restrictions on sales of e-cigarettes, so anyone could go into a shop and buy an e-cigarette. But from October 2015, regulations were brought in to align e-cigarettes with tobacco in terms of kind of age of sales and proxy purchasing, etc. From the middle of 2016, the European Union Tobacco Product Directive regulations came into force, and that bans quite a lot of forms of advertising. So TV and radio advertising is banned now. I remember actually I was never that aware of much TV and radio advertising for e-cigarettes, but in the couple of weeks before these regulations coming in, they seemed to really kind of pump them out. That's the first time I became really aware of it. e-cigarettes that contain nicotine, that they now have to have kind of warnings on that cover 30% of the surface of their packets regarding the addictive nature of nicotine, to try to kind of reinforce the message that these are products that we'd encourage smokers to use as a form of kind of nicotine replacement therapy, as a way of helping them to quit smoking. But if you're not a smoker already, they're not a device that we'd encourage anyone to use. So at the moment, the data that I've presented today, we're kind of halfway through a project which is kind of evaluating the impacts of Tobacco Products Directive regulations on kind of young people's experimentation with e-cigarettes, and whether that kind of interrupts the kind of growing sort of normalisation of e-cigarettes, kind of independent of their association to smoking. But notably, this is EU legislation. So with the elephant in every room at the moment, Brexit looming around the corner, there is potential for some of these regulations to be changed over the next few years. So our work will potentially kind of feed into sort of decision making around that. I mean, the default position is that regulations kind of remain on the statute books, but they are likely to be kind of reviewed. And I think the English government, at least the Westminster government, have kind of expressed an intention to kind of review the Tobacco Products Directive regulations and see how those are kind of working and whether they need any sort of refinement going forward. I think another kind of note of caution, even though we kind of do talk about the rapid declines in youth smoking as being kind of a real public health success, youth smoking does still remain a key sort of public health priority, despite significant improvements. Not just under almost 1 in 10 young people still leave school as smokers, and smoking is something that is transmitted quite strongly from one generation to the next. The biggest driver of being a smoker is having parents who smoke. So, and particularly kind of young people from poorer backgrounds are much more likely to take up smoking. So it's still kind of a major contributor to the gap in life expectancy between rich and poor. So just because we've seen rates coming down, we shouldn't be complacent. I think we do need continued action to reduce or even eliminate youth smoking altogether. Just some acknowledgements. This is an acknowledgement to the funders of the research that I've just been presenting, and one of my co-investigators on that project, Professor Linda Bold from the University of Edinburgh. I borrowed some slides that she's used for some of her talks on youth e-cigarette use, so my acknowledgement to her as well.
Thank you very much. I suppose the question for me, we know from our data that some schools the smoking rates have dropped more, and obviously we've talked about all those reasons, but I mean, how should a school, perhaps where they're very low, would that be a priority still, do you think? Or I suppose that's the issue, isn't it, when it's
yeah, I mean, it is challenging, because I think in the schools where smoking rates are very low, smoking is probably kind of concentrated amongst young people social networks. So I think it probably requires slightly more targeted forms of intervention than some of the more universal approaches that have been effective in areas where there are sort of bigger problems with smoking. We do have the kind of postdoctoral fellow here at the moment who's doing kind of work around that, kind of understanding what kind of differential models might need to be used for smoking prevention in sort of richer and sort of poorer schools where you have very big sort of differences in the context of smoking and the nature of kind of smoking prevalence.
That would be really interesting, because I think that's probably, with a sort of teacher hat on, that would be what we might need sort of support and help with. So that's really good to know. And I mean, I think, you can't lose sight, I'm a bit older than you. And so smoking, I've really seen the change. And I think it is really good to report, on a sort of positive, public health, message. So thank you very much indeed. I'm just going to move on, and then if anybody does have any questions they want to ask, we can sort of pick them up again. But just move on to a little bit of network news. It's always good to take the opportunity to share those. So for the schools amongst you, we have sent out to you all a student health and wellbeing report usage survey. That information is so useful for us. So if you have a spare 10 minutes, if you would like to just do that electronic questionnaire, we would really appreciate that. And within that, we do actually ask if you're happy to share the use of your data at our summer events or in newsletters, and so I'd always encourage you to get in touch on that too. Graham did mention that there's going to be the first network national report, so just to say that if you felt you, this will come sort of within the next month or so, but if you'd like some pictures on health and wellbeing from your school, or what the young people in your school consider health and wellbeing is, then you can send in photos, or they can send in photos, and we could use those on the cover of that report. The crucial thing are dates for diaries, which we've been letting you know for some time, but our summer events, we run the 3 national summer events, those are the dates. And the newsletter that will be arriving in the next week or 2 will give you the opportunity to actually register for the event. I know we really love seeing you, and I think it's really good for you to be able to share practice and just talk to other people who are working on the same sorts of issues as you are. So again, just a really big thank you for joining our webinar. All the previous ones that we've done on all sorts of different health topics can be watched at your leisure on the network. On the network website, shern.org.uk. Just a quick thing, there will be a research brief that links to this, and so we'll be tweeting when that comes out. And just in terms of storing this, as Graham says, we can't do that until the embargo is lifted and the publication is out. So as soon as that happens, we will put that onto the network website as well. So thank you very much. Thank you, and bye.